from London. This is Mariam Sharif, and you are watching and listening to the Star Moguls podcast. So I had a image consultancy in London, in Mayfair, and I used to have a black book of all the contacts that, you know, were useful. And recently somebody asked me, do you know somebody for Botox and fillers? And I was like, I don't really know anybody. But so this next guest of mine found me. And I'm so delighted because I have so many questions for her. So I'd like to introduce you to Dr. Turner, and she's a plastic surgeon in Harley Street. Welcome.
Hello, thanks for having me.
How are you?
I am great. Just really happy to have a little chat about all the bits and the bobs. I'm always really delighted to answer any questions, because I spend most of my time with my friends doing that as well, and it's just,
Yeah, exactly. So when I'm like, as a stylist, you enter a gathering, a party, and the first thing everybody says, "Oh, what's going on with makeup? Can you give me some styling tips?"
Yeah.
This kind of style doctor, or you, as yourself, you probably get lots of questions, and
you end up in the corner. It's like, and then just one more question. But no, I honestly don't mind.
You know what actually grabbed my attention firstly is that most of the plastic surgeons that I know of or I've heard of are all male. And so it's nice to have a female plastic surgeon. How long have you, been in this industry?
God, almost I'd say about 10 years now. But I've been in different countries, and so in my current practice that I've set up, probably about 3 years.
Right, in Harley Street.
Yeah, exactly. Yeah. And yeah, it's I just love it. It's just something. I mean, I've been very lucky that I found my niche, I think, in medicine.
Yeah.
And it's just, I think being a female definitely helps.
It definitely helps relatability, isn't it? Because I was just speaking to a friend of mine, and she's, "Oh yes, I've got somebody," and because I was actually asking for another friend. So I must admit,
everyone's always asking for a friend.
Well, no, but actually, this is a big confession of mine. So I have to admit, I'm obviously in my 40s. I have never had any Botox, fillers, surgery.
You look fantastic.
Nothing.
Definitely good genes.
And so, well, I don't know about that. I think it's just happiness and great makeup. But so that is my confession to you, Dr. Turner. And so I'm a complete novice and kind of, virgin to these kind of treatments. And so when somebody asked me, and I was like, oh, I'm really not sure, because I haven't had anything done myself. But now I'm on, video more. And like you said, you're more visual. So you do pay attention, because as a makeup artist and stylist, I'm always behind the camera. So with the podcast, now you're in front and you kind of see everything as it is. And, I should have this, or I have to have that. But so when I'm asking you, I will ask you completely like a beginner. And for those ladies and men, or anybody that is listening and watching, what you need to do when you are actually wanting to approach a treatment and you want something done, and what is the technicalities of it all. What is the process that should be going through your mind, and what should you be asking your consultant, basically. So I love the fact that you're female, because it's nice to see in the medical industry, medical field, that there aren't many. And you were just mentioning actually a fact, like a little fact about how many men are compared to women.
It's really funny, because I was reading the other day, there's 90% of our patients are female, but 90% of the plastic surgeons are male. There's only one other, in my kind of group of colleagues, and all my people who would have trained me all through my training, etc. I only had one female, and that was probably out of about 20 male bosses over my time. So it is very heavily male dominated, but I think it is slowly changing. There's a lot of younger girls coming through, and I have some registrars who are female, and it's a breath of fresh air to the industry, I think. And also, but I think it takes a little bit of time for patients as well to get used to the fact that their doctor isn't kind of an elderly male in a suit. You know, I think it's all just
Yes, you have
taking its
the
time.
impression. Exactly. I have the impression if I'm going to go down, literally, I'm going to go down Harley Street, and this is, you know, my friend even said to me this morning, she goes, "Oh, I've got no, I know somebody, I can give you somebody." And I was like, "No, I don't want somebody for myself. I'm just asking you." And I said, "Oh,"
Yeah.
and he said, "He's male." And I was like, I don't really want, you know, and I guess this is what I like, the fact that the industry is changing, you know, the field is changing.
Yeah, definitely. I mean, there's so many super male surgeons and super male
Yeah,
doctors,
yeah.
but it's such a personal thing. I mean, I think, you know,
It's
for
an
me as
intimate
well,
conversation, isn't it? It's a really
yeah,
intimate, yeah, yeah.
and it's, you know, it's because we all feel it the same. It might be about a different body part, or it might be about a certain feature of our faces that really, really gets to us and gets us down, or just we just don't like, or that is changing over time. And you know, I feel that, because I'm like, I can feel when I look in the mirror and I go through the exact same things. And I think
Yes.
it's also helping me, and has helped me thus far, because, you know, I'm so keen to, you know, to find solutions to my own problems, and my, you know, the problems of my you know, my female friends, and, you know, my mom, her friends. You grow up hearing about all the things that women complain about, so, you know,
Yeah.
it's so ingrained.
Exactly. I think that just having that empathy as a woman to understand another woman's, you know, situation, and you know that you wake up, or you know, you've gone through different phases of life, from, you know, like either waking up in the morning and if you've got kids and you're literally at the house like this, or you know, you're a young professional and you're trying to make it, you know, you're working longer hours, or it could
With
be
the
anything.
dark sort
And the body changes as a female.
mm,
You know, we go through, you know, our cycles, and then our menopause, and you know, all the other things that are yet to come.
yeah. Life,
But
you
then,
know,
yeah,
life just
life
has its effect on our
changes,
body.
life changes, so you know, your body's going to change. But this whole concept, so when I was I'm going to share a little story with you. So I had my image consultancy in Mayfair, and alongside that I also had a VIP matchmaking service, in which where I would help professionals, young CEOs, matchmake, but also style them for their first dates or proposals and all sorts. And it was wonderful. And I was interviewed by a newspaper regarding my exclusive, you know, matchmaking service, and I had suggested in the interview, and which I do suggest to my, you know, clients at that time, that's 10 years ago, and especially to the Asian industry, that, you know, if you need something done, a little, you know, little something somewhere. Mainly, I
Yeah,
was talking about teeth, but like, you know, anything, you know, a little adjustment here and there.
a
Well,
little
why
tweak.
not? And you know, even for hairs or for teeth or anything that will improve you aesthetically, to give you a better chance to be, you know, more attractive. And why wouldn't you? Why wouldn't you, if you're excelled in your
Yeah,
professional life? Why wouldn't you want to match that with your aesthetics, with who you are all day long? And so this was picked up, and now I think about it, Dr. Turner, in a decade, how everything has changed. You know, now I see, like, the pedicures and the manicures, the facials that you would have during lunch. You've got like lunch time treatments that you can have that
yeah.
are non-invasive, and you can literally be out and like within an hour or a couple of hours, and you know, and it's getting easier. It's kind of the takeaway of
And
treatment.
it's becoming so much more common. You know, it's like,
Yes.
back then, people, you wouldn't talk about it. You know, it was
No.
very taboo. It was like, oh, you know, no one really wanted to know, let, you know, have people know that they were getting their Botox and this and that. But now it's really, you know, it's become much more, everyone's much more open about things like that, and rightly so. I mean, like you said, if it's something that's gonna, you know, make you happier, and if it's something that's, you know, obviously safe and appropriate,
Yeah.
why not? Why
I
not?
had and I think you said, you know, happier. So if it's life changing, and it means that it's something where you're really going to feel the benefits of a long term. You know, sometimes we can do things out of vanity, but
Yeah.
I had a friend from boarding school, and we had finished our O levels, and she had a nose job, you know, and uh, she was beautiful, Dr. Turner, like 5'9", 10, slim, beautiful. But
Yeah.
you know, her nose was like probably out of proportion, and she felt it more than anybody else. And I think even her parents encouraged her to get it done. And you
Mm.
know, that one life-changing moment procedure of however time it took her has changed the rest of her life. The course of her life has completely changed regarding her career, her relationships, and everything else. And so that one aesthetic change has changed her whole course of life. And when I think about it, I was like, in those days when I was 15, for goodness sakes, it was like, I would think surgery or plastic surgery was about reconstruction, or somebody's had a car accident or an acid burn victim or something, and it's a reconstruction. And then I kind of moved into where I early age in my teens kind of discovered, okay, people are having surgery. So it wasn't new to me. And I think it also depends on the environment and the type of people or environment, who is around and who's wanting to reveal these things. And I think from that social status as well, in boarding school, kind of got to know a lot of things. So even that was a taboo. But I'm talking about Pakistan. This is a procedure that was in Pakistan, so it was really remarkable. And now I look at it and it's completely changed. 10 years down the line, you've got invasive, non-invasive. So I want to discuss that really. What kind of treatments, if somebody's looking to, the first thing is, I think, if someone is looking to do a treatment, what should they be doing? Because there's invasive and there's non-invasive, right? So something that you literally have to go underneath kind of anesthetic, or would you need an anesthetic for both, depending?
So in general, most of the invasive things you need to be put to sleep for. So when I talk about invasive things, I talk about facelifts, rhinoplasty nose job, large volume liposuction, tummy tuck, things like that.
Yes.
Everything else you can basically do without local anesthetic, or with local anesthetic, excuse me. So they would be we would categorize them as non-invasive.
Yes.
Even though you need some local anesthetic, in the form of an injection, it is non-invasive to us. So that's how we categorize them. So anything you've basically got to go to sleep for is invasive, and anything you're awake for and that I can chat to you during is non-invasive.
Yes.
And I think it's probably very daunting for people, because even when I talk to my friends and they'll say, oh, I have this, that's, I'm just even talking over the weekend, I was chatting to a friend, and as she's gotten a little bit older, she's in her mid to late 40s now, and she's lost some weight, and her hands have gotten she feels her hands have gotten very old looking. She's lost a lot of volume on the hands, and she's like, she just doesn't know what can be done, and how, what should be done to kind of improve the appearance of her hands. So I think it's a good idea you just need to go see someone and describe what you want to achieve, because that's always the first question that I ask anyone, because there's so many different types of procedures, and you might see something online and it might be it could be, but it could be not the appropriate treatment, or it could be something that's not going to actually target what's really affecting you.
And it's a really personal thing, isn't it? So something that bothers one person might not bother somebody else.
Exactly.
Somebody who has a problem with their jawline or their eyes, and it might not have a problem. I've also got an Iranian nose, but for me, I didn't want to do that, right? I'm such a chicken when it comes to that, and so, as a makeup artist, I know how to maneuver, and I know how to contour, and I learned the art of makeup. So that helped me, but I'm sure that, there's certain things that are very personal to somebody that probably they don't even feel. And the next person would say, well, no, this is like a deal breaker for me,
Yeah. Oh my God, definitely. And I think that's what I notice, is that patients are very, very honest with me, because I think a lot, I would have seen, when I would have been working with some other older male colleagues, and when I was earlier on in my career, some people, they try and they brush it off, because they think, oh, it's not a big issue, or that's fine, you don't need that. But everyone's personal issues are their personal issues, and that is definitely number one. You need to get to the root of what is bothering that person, and what are the options then, and then you can go from there. And there's definitely not a one treatment fits all, regardless. There's definitely not we can just do that non-invasive, or we have to go invasive. It really is. I think it's probably one of the things that I enjoy most about plastic surgery, is that it's so tailor-made per patient. You really have to draw up a plan for whatever treatment or procedure you're going to do, and yeah, it's I think a little bit different than say things like general surgery, where if someone has a problem with their appendix, you're just going to take that out and that's that.
Yeah.
You know, it's a little bit
Define our
more.
appendix.
Yeah, it's a little bit. Sometimes it's a bit like kind of like solving a puzzle, but it's fun.
You know, I was looking at the statistics for the UK, especially, so 2018 and 2019, and I saw there was you know, the statistics say that women, the most popular treatment or what they're going for is a breast
Breast augmentation.
augmentation, and men rhinoplasty.
Yeah.
So that was, and that kind of shocked me actually. So is there a trend that you're seeing in 2020?
2020 is, for me, is all about the face.
Right.
Well, there's two things. So it's about certain things on the face that people are seeing. So it's people, men and women are seeing their lower face aging, and that is because of how we are living at the moment. We're just on screens most of the time.
Yes, yes, absolutely.
So people are really focusing on. So there's a lot of people coming that have I'll have women or men, and they say, "Oh, my jawline just isn't. It's kind of getting saggy." And a lot of men and women, but more men, I think, for eyes this year.
Oh, right.
And I think liposuction. I mean, the liposuction is always really popular, but you know, because also I think people in 2020, they have the opportunity to have some downtime if they need that.
Yeah.
That's being really popular at the moment.
So, like, I haven't had anything done, and I've actually gained weight, and so I had a friend of mine said to me, she goes, "Have you had Botox done?" And I was like, "No, this is natural fat. It's nothing else except for just I've just plumped myself up naturally."
There is nothing worse than losing weight for your face. It's just,
you know, and
it's
what
awful.
it is. I'm actually afraid of now losing the weight, because I'm like, I might just kind of, you know, go down. You know, we can't we can't deny gravity, but we can, you know, we can delay it for, you know, as long as we can. And I've noticed for my own self that I laugh a lot. You know, I laugh a lot. I smile a lot. I don't think I have a you know, one of those faces that just doesn't talk, or I have movement in my face and my body all the time. And I do notice that I have lines and stuff. And I, you know, as you get older, you just, you know, it's just aging. And what can we do? This is just fact of life, isn't it?
Exactly. I mean, unfortunately, and it's the way females age as well. It's very specific. Men tend to, I think, get almost better looking with age, the way, and that has a lot to do with the anatomy of their faces as well. But with us, everything tends to go south. And that is definitely something that I think is probably, with regards to everything in the face, the thing that I get the most of is ladies coming and saying, "This used to be here. Why is this here now?"
Absolutely. I think when I was just doing some makeup tutorials recently and filming them, and I was talking about how to place the makeup. So literally you're lifting the face. And so, but with such procedures that were just so great. You know, I was reading something about threading. And I first thought threading was the Asian way, where you take the thread and you're actually
for your eyebrows. Yeah,
but it's not threading. Can you explain the threading, because it's quite a popular one that I've been reading about, and because we're talking about women, especially about features, about the sagging on the lower half. Can you explain a little bit about that?
Of course. So so essentially what it is you have these long threads, okay, and they have these little cogs on them. And what you do is you bring them, you essentially tunnel them underneath the skin. So it's non-invasive, but you need an injection of local anesthetic to have it done. Right. And say, for example, if you wanted to lift this area, I'm just looking at my hair there, it's a bit crazy. So you have an anchor point here in your hairline, and the thread will be tunneled down, it will come out here, and you will literally pull the skin back like that. So you're tightening the thread, and the thread embeds in the deeper layer of the tissue to give you that lift.
So does the thread stay in there, or does it dissolve, or does it just...
It dissolves, yeah. So it really depends. With that, that's one thing. If anyone is considering getting threads done, they need to make sure they get the high quality threads, because there are so many threads on the market that I've seen problems. I've seen I've actually had to surgically remove one lady's threads because it was like an off-brand, and they didn't dissolve, and then they create this horrible reaction, which is devastating. I mean, that's a devastating thing to happen to anyone.
Did it go
But the threads,
side, or did it, what happened?
so what happens is they form it's a foreign body reaction,
Oh,
okay?
right.
Because you get these clumps in the face, and that you had to just remove all the threads. But the good threads, the normal threads, the ones that most people who are doing thread lifts use, are made out of substances that the body dissolves. So similar to dermal fillers, and the body will break them down over a period of time. And in the process of breaking them down, what's left is strings of your own collagen.
Right.
So that's how you get a kind of a little bit of a longer effect.
Right.
But
okay.
they can work really nicely when you just use them with some really dermal filler, just putting onto to give you some bone structure. And I always find people are always really scared when you say dermal filler, because dermal filler has, you know, a really bad reputation, because we've all seen so many horrible examples, you know, people just being really puffy. But if you use it, you know, carefully and in the right place and at the right level of the face anatomically, it can really transform the face.
So I've obviously come from the Middle East after spending like 6 years there, and I can see like a lot of people, a lot of women really take pride in their appearance, which I think is fantastic. And so it's actually surprising, the more that I was in that environment, I didn't even pay attention. I was just so in my own self. But anyway, what I think I was just living off the sunshine. I was just kind of happy that I was there in the sunshine. But I wanted to ask you, so there's a lot of things that do go wrong. And how can we avoid that, right? Because I think that's something that you should kind of be prepared from the beginning, right? What kind of questions should be asking yourself and other people? And because I always say that you should have it, you know, that surgeon should be approved by one of the boards, you know, depending on where you live. What would you suggest? Okay, someone who's wanting to do something, what would they do initially? What's the first kind of first couple of steps that they need to be asking or researching, I guess?
So I think the really important thing is that the person that you decide that you entrust to do whatever, is that they are able to deal with the complications that can arise, because any treatment, whether it's non-invasive or invasive, there can be complications. You know, you can't do anything to the body without there being the potential for that. So but the difference is being able to identify them early and then manage them. Okay.
Right.
So that would be, so if someone was going for, you know, wanted to do some thread lifting or fillers or things like that, anti-aging treatments to the face, you know, things that can go wrong are it can go into blood vessels, and you can, you know, everyone has seen those horrible cases, you know, or read about there being things like blindness occurring, bits of the skin dying. You know, you need to go to someone who is able to identify those kind of complications early so that they can be reversed. So that would be the one thing I would.
And I think this is why I always say that, you know, make sure that you have somebody that is kind of recommended and reputable, because sometimes, you know, if you want to save a bit of money, or, you know, you're looking to do something, because there's a lot of cases of this last few months where people are doing procedures, like I said, at home procedures.
Oh my God, yeah.
I was shocked as well. I was like, how could you even risk yourself, your face, your body? Like, why would you want to do that? It's such a complicated procedure, and people just think that. I think yes, it's become more common, but it doesn't mean that it's become easier, you know. And I think people have they've translated it differently, where people think, okay, it's only a filler, we're looking at an injection and just fill it in, and they just don't understand what they're doing.
And there's a lot that, I mean, I think I would be in the camp. I think there's there's so many talented people that do it, but I think if you're doing it, you should be able to deal with the type of things that can occur, and you should really know the anatomy literally inside out. You know, you need to it's not enough to just go to a course. You know, if someone goes to a course for one day and gets taught one technique, you know, they need to have a little bit more wealth of experience, I think. And you know, when you think of surgical training, goes on a long number of years, you know, from the very beginning to the end, it's about 15 years. So, you know, that's not a type of experience you can get in maybe a one-day course.
That's exactly what I say. Yeah, exactly. I mean, you know, a lot of people are doing, you know, little courses, and then they're off they go, and then they do this treatment. But I'm very, very scared of people who don't have the knowledge or the expertise behind them.
And
And this is what I always say, you know, do your research, really kind of look into that person. And when I discovered you, I was like, oh my God, it's so amazing, because you have such a wealth of knowledge. I detected a little bit
still
of
learning every day, like literally, and that's what's also so challenging and fascinating about it. And even people who are at the very end of their careers, they will say that, you know, they'll be like, oh, that's, you know, that's what I learned today from that. You know, it's really, but you are usually able to apply something that has happened in your experience toolbox to you know, to solve any problem that arises, you know. But you still, you know, it still can be very challenging no matter what stage you are in.
I just wanted I hear a little bit of an accent, and so I just wanted to ask you, where are you originally from, and where did you train, so people know that, you know, that of your expertise, and how long you trained, and, you know, the amount of work you've done before you moved to Harley Street. So I hear a bit of an accent there.
Yeah, so I am Irish, Southern Irish, born in Cork, grew up in a big family in Cork. And
do you come from a medical-based family? Because I know, like, you do.
Yeah, my dad was a doctor, my mum was a midwife. But they never really kind of said, oh, you should do this. I think it was actually one of my mum's friends said it to me, because she said, I was quite a chatterbox, and she said, you know, if you become a doctor, you can just talk to people all day long. So I thought, okay, that's a good idea. And then my dad was like, okay, well, that's a good reason to do it. But so that's kind of how I decided to do it.
My niece, because obviously I'm Asian background, so my niece, obviously they want her to be a doctor, but she said, I want to be a singing doctor. I want to sing, but I also am going to heal my patients by singing. And I was like, oh, that's
she could.
So
well,
I mean,
she could sing, and then she could play. Like, I always play music in theater whenever I'm operating, so you can, you know, she could record her own tracks. She could be a singing surgeon. Could be
so you trained from, and you university?
Yes, Irish graduate, yes. And then I did a lot of my junior training, my junior surgical years, those crazy years when you're like working like 80, 100 hours weeks, just living off giant bags of Starbucks. And then I moved to Germany, and that's where I did a lot of my specialist training. Specialist training there.
Are they much more advanced than England? Is Germany more advanced, or did you choose that for a certain reason, or was...
I chose it basically because I decided at that stage that I wanted. So plastic surgery is very broad, so it covers, as you mentioned, all the burns reconstruction, cancer reconstruction, hand surgery is a huge element, and aesthetic surgery, obviously. You train in all of these areas until you can kind of do the aesthetic part. But why Germany really appealed to me is because their health system actually covers a lot of the aesthetic procedures. So so things like, you know, people who have lost a lot of weight and have excess skin, their tummy tuck would be done on their version of the NHS. You know, the same for women who've had babies and need that skin removed, that tummy lifted, because it's considered, you know, it enhances their life. It's a quality of life thing.
Yeah, lifespan, exactly.
So that meant that I was getting exposed.
Actually, medically, isn't it? It's a medical reason.
Yeah. So that meant that in Germany, my exposure to you know, cosmetic surgery, which you don't tend to get in some of the other European countries. It's not as widespread. You know, you don't get exposed to it really in the UK or the Irish training system. So that was essentially why I went. Yeah. So and then it was crazy, but it was hardcore, but it's definitely been worth it.
Yeah, and you also have a Middle East connection as well, because you've done some work out there, or you have your clients out there.
Yeah, so I have a lot of Middle Eastern clients here, but actually I'm due to start a part-time role in Doha. But I was due to start that in January. But obviously with COVID and with the travel, with the entire situation, that's obviously been put on pause. But because of a lot of what I do is and they don't, there's not as many female plastic surgeons. So for things like the kind of the procedures I just mentioned, so reconstruction after weight loss, things like that, that's essentially what I'll be doing out there.
Oh, wonderful, wonderful. That's
Yeah.
great. Well, I was going to ask you, so back to the fillers and Botox.
Yeah.
A couple of girls had gone and they were talking over lunch, and they said that actually fillers could be actually quite good for you. And because of the ingredients that they have, it could generate, like, stimulate the skin and produce collagen and actually stimulate your cells. So people think, so don't think that it's because I always think, oh God, something's going into my body and it's something alien. I mean, I don't even take paracetamol. But how can something be like that be a benefit? Is that right?
There's a huge amount of the newer products, the newer generation. There's ones that are essentially, you just use them very superficially and they increase the hydration and the turnover in your skin hugely. It's just about the cells that are used in them that upregulate your own cells processes. And there's ones that you can use for, deeper, that they start your own body's collagen production. So they kind of start this reaction. So you end up producing your own collagen. You're not just using, the artificial substance to give you the volume. So there's all the newer generations of really, really high-tech remodeling properties.
It's quite sophisticated, isn't it? It's completely different to what it was a decade ago, 5 years ago even, because
oh my God, completely. And I mean, interesting, I remember even when I first learned how to do Botox, and the dosage, even what was suggested to use then, that is, totally, it's been proven that that's wrong, and that's, we use a much lighter dose than we would have used. So it's things are progressing all the time. But there's a lot of benefit for your skin from using some of the newer models of dermal fillers. Yeah.
So if there's someone who is looking to do something a little bit more invasive, like maybe a tummy tuck or a rhinoplasty, what would you suggest to them for them to do their homework before they come in, to come and see you? What would you want a patient or a client to do before even coming to see you? Like, can you explain, say something, if we take an example of a tummy tuck, what is the process of that? Because I understand, it's not just having the treatment, it's before, during, and even after, because
oh my God,
there's a lot of psychologically as well, you have to be prepared. So if we take an example of a tummy tuck, what would you suggest someone should do before seeing you?
So someone who is coming for a tummy tuck, first of all, they have, there has to be a certain criteria. For example, there's no point in doing a tummy tuck if you're planning on having any more children, so kind of to have completed your family.
So you wouldn't just accept somebody just to come in for a procedure. You would really kind of talk them through why. And
oh, for sure. And ask them, like, examine each layer of the tummy, and you ask them what exactly is bothering them most around the tummy, because maybe you